Hello, you're welcome to this presentation. Thank you for visiting this channel and for watching. Thank you for your precious time. I really appreciate that. Thank you again. So in this video, I want to give an overview of the standard first aid and CPR AED training which is planned. And you are watching this video because you want to take this course, or you are planning to take this course, or you have enrolled into this course. So the objective here is to provide the overview of what is coming. So please, I want you to read it, take note, and enjoy the presentation. The objective, so what the training is about. So the standard first aid and CPR AED training. What is it about? The second objective will outline the topics to be covered. So the topics that will be covered during the training, I'll give you a quick outline, a quick overview of those topics. The objective number 3 is to let you know of the expectations. So what is expected of you, of the students, of those that enrolled into this course, those that will be participating in the training. So what is being expected from such participants? So that will be the third objective. About the training, so this is the first objective. This training is on standard first aid and CPR AED. So that is what the training is about. It is a 2-day or 1-day training program, depending. So if you are taking a full course, and most likely many of you are taking the full course, then it's going to be a 2-day program. But for those who are recertifying, who are renewing, their certificate is going to be 1 day. The 2-day training is approximately 16 hours. 1 day is approximately 8 hours. However, to recertify, for you to renew, it means that your current certificate is still active. Okay? If your current certificate has expired, then it is going to be a 2-day program. Okay, that is the right program you should enroll into. What to be learned? So what are we going to learn in this training? Okay, of course, many things will be learned, but it is important we talk about the emergency, which is any unplanned incident or situation which can cause illness, injury, or death. And such requires immediate, urgent action or attention. Okay? So that is actually what necessitates first aid. So the participants will learn. They will learn important life-saving skills to care and support anyone in emergency. So this training is all about saving lives. What skills, what techniques should be used to care and support somebody in need, somebody in emergency, okay? Somebody who is ill or injured as a result of unplanned situation, unplanned incident, which we call emergency. So the training will focus on first aid. First aid is life-saving skills, okay, which you can employ to care, to support anyone in emergency. And remember that emergency can happen anytime, okay? So we need to be ready. In other words, this training is meant to equip us, to get us ready proactively in case emergency shows up anytime, any day. So we will be able to respond if such happens. Training components. So there are 3 components. Okay, the first is theoretical components, and in this we're going to do mostly teaching, and there will be discussions and interactions. So the class discussions, lecture presentations, and many techniques that will be used. Okay, so we're going to focus on some of the theoretical component and concepts. There will be definitions as well. Okay, and then there will be practical component. Okay, this is hands-on. This is practice and demonstration of skills. All right. So the prominent among them is the CPR AED, wound care, fracture care, which is using a splint, sling, and many skills that will be practiced. And the third component is exam. So this exam belongs to the knowledge-based testing component. We'll talk more about the exam soon. So course content. The content of the course is mostly based on the heart and stroke first aid reference manual. Okay, we're currently the one that will be used in the training is 2015 edition. Okay, in future there may be newer edition, but the one we're using for the training as at today is 2015 edition. So most, about 95 or 96 or 98% of what we're going to discuss will come from this book. Okay, so it is important you have it, because all we're going to say, all the practice we're going to do will come from this book. Course structure. So in the training, I will try to structure the course in such a way that it will be easy to follow. So there will be an overview, and then there's first aid part, and there's CPR AED part also. And so the overview will be found in the first chapter of the book, the manual. So the first chapter will provide the overview of first aid. So we're going to use that chapter to look at the overview of this training of first aid. Then the first aid part, okay, would come from these chapters: chapter 2, chapter 3, 4, 5, 6, 7, 9, 11, 12, 13, 14, 15, 16, 17, and 18. So these chapters will cover the most of the first aid activities. Okay, and then the CPR AED part. So there are 2 chapters in the book that will talk about CPR AED, that is respiratory and cardiovascular emergency, and that will be chapter 8 and chapter 10. So the outline of the topics. So these are the topics and these are the chapters where you're going to find them in your manual in the book. So the first chapter covers emergency scene management. So this will provide the overview to the course. So chapter 2 will be about shock, fainting, and unconsciousness. So bleeding and wound care, chapter 3. Okay. Asthma and allergies will be found is chapter 4. Head, spinal and pelvic injuries, you find that in chapter 5. Diabetic emergencies, chapter 6. And seizures. Seizures are neurological conditions. We're going to talk a lot about seizures, and that is chapter 7. Respiratory and cardiovascular emergencies. This is the biggest chapter 8. Chapter 8 is the biggest. We'll talk about respiratory, cardiovascular, talk about heart attack, cardiac arrest, high blood pressure, stroke. We're going to talk about TIA, transient ischemic attack. We're going to talk about angina, how to prevent some of these things, and how to respond to anybody who is having any of these emergencies. So chapter 8 is really a very, very, very big chapter. And then chapter 9 will be about burns. We'll talk about first degree, second degree, third degrees, burns, and other related topics. So continuation of the outline of the topics. So child and infant resuscitation, chapter 10. Secondary survey, chapter 11. Bone, joint, and muscle injuries. We're going to talk about RICE, RICE. Okay, and that will be chapter 12. Poisoning will be chapter 13. So we'll talk about what to do if somebody is in poisoning emergency. What about eye injury? We're going to talk about eye injury in chapter 14. Chest injuries in chapter 15. Some emergencies are environmental related. Some illnesses and injuries can come from the environment, and so we're going to talk about this: hypothermia, frostbite, heat cramp, heat exhaustion, heat stroke, and chapter 16 will be where you get that. Lifts and carries. So sometimes you may need to move the patient, the person who is in in need. You may need to move the person to a safer area. So we're going to look at some of the techniques, and you're going to find that that topic in chapter 17. Then there is a multiple casualty. So this relates to when there are multiple people in need. How do you go about that? If you have 2, 3, 4, 5 or more people who have been involved in some emergency and they need help. So this topic will tell us how to go about managing such multiple casualty situation. And in your book, in the manual, that is chapter 18. Expectation from participants. What is expected of the participants? What do I expect from you, the person taking this course? Before, so I'm going to let you know my expectation before the training, the expectation during the training, the expectation after the training. Before the training, get the acceptable course manual, okay? And I've already told you the one that we're using and the one that I expect you to have is from Heart and Stroke Foundation, Canada. So you can actually gloss through the manual. So when you get it, hopefully you get it before the training date, before the first day of the training. Okay, so I expect you to go through it. You don't need to read so deep. You don't need to finish everything, but at least have a feel. Okay, at least, yeah, go through it and see if you can get something. Okay, I'm sure you will. So be expectant. This is very key. As you come to this training, I expect you to be expectant. You should be expecting something good, something great. This is not ordinary training. This is unique. This is important. So I expect you to be excited. I also expect you to be expectant. Get your writing materials ready. Get your writing materials, pen and paper. Bring them. Get them ready. Don't forget to bring enough food, snacks, and drinks. Don't forget it. This is important. Dress appropriately for practice. Appropriately for practice. Please dress appropriately for practice. Let your instructor know of any serious health conditions that may prevent you from bending and other activities. Okay, let your instructor know beforehand if you have any serious health conditions that might limit you from doing some activities. Please, this is important. During the training, when the training is on, participate actively. Active participation is expected. Active. Be active. Participate in discussions, in answering questions, in contributing your own idea. Okay? Participate actively. Very, very, very important. Ask questions. Ask questions, please. Okay? If anything is not clear to you, don't be quiet. Okay? Ask. There is no harm in asking. Your question can reveal many things. Please ask question. Every question is welcome. There is no small question. There is no unreasonable question. Every question is reasonable. Please ask when it is necessary. Take notes. Keep yourself busy. Take notes. Take notes. I've already told you to bring pen and paper to the class. A lot will be said, a lot will be revealed. Many things, many skills, many knowledge, many definitions, many descriptions. Bring your note. Bring your pen and paper. Keep yourself busy during the class. Keep your hands active. All right? Take note, take note, take note. Okay, the written exam. There will be a written exam at the end of the training. The last activity we're going to do will be the written exam. The exam will test your knowledge of the course content. So the exam will come from the book. The exam will come from the discussions, from the topics we're going to discuss, from the practice we're going to do. So the exam will test your knowledge, how much you know, how much you have learned. That will be tested at the end of the training. It is a multiple choice exam. Multiple choice exam. Every chapter in the manual will contribute at least one question to the exam. So every chapter will contribute at least one question to the exam. However, chapter 8 and 10 will contribute most of the exams. Chapter 8, chapter 10 contribute most of the questions. So I told you that chapter 8 is heavy. It's the longest, the biggest, and there's no surprise that chapter 8 contributes most of the questions. The pass mark is 75%. I am so excited. I am looking forward to this training. I can't wait. I don't even know how to describe how excited I am. You know why I'm excited? Because we're going to talk about how to save life. Okay? Thank you for enrolling. I cannot thank you enough for enrolling in this all-important course. This course is important. Very important. So this is the reason why I'm so excited, and I'm looking forward to meeting you in the classroom shortly, soon. Okay, my classroom is always excited. It is fun. It is engaging, full of energy, full of knowledge. You will learn a lot. You will learn it. You will not regret. In fact, after this course, you'll be looking for your friends. I'll be telling them, go and take this course from this instructor. All right? Knowledge packed. Knowledge. Very knowledge packed. Loaded. I cannot explain it. So this is why I'm so excited. I look forward to meeting you soon in the classroom. Please check out and subscribe to this channel for more first aid and CPR, first aid, CPR and first aid tutorial and videos. Thank you and see you soon. Bye.